Hey everyone, I'm Dr. Abin, an interventional radiology resident, and in this video, I want to talk about branches that give you life beyond medicine. So I know MBBS is very hectic. You have a lot of exams, you have a lot of night duties, and a lot of sleepless nights. So what if I told you there are a few postgraduate branches that actually helps you enjoy your work, gives you time outside work, enjoy your holidays, go on trips, and actually follow your passion? So before I start naming branches, I want to tell you my criteria. So first one would be a good work-life balance. The other one would be you actually have enough time to chase other dreams or other passions. Third one, a decent lifestyle. And the fourth one, minimal burnout. So the number one branch that will top every single list would be radiology. Why radiology? Because you have a 9 to 5 job or a 9 to 6 job. Your work hours are predictable. In fact, you can choose your work hours. So if it is in corporate, it's usually 9 to 4 or 9 to 5. If it is in another scanning center, you can choose your work hours 9 to 1, 1 to 4, 4 to 6, etc. And the work is pretty relaxed because you sit at one place in an AC room and you'll be seeing the scans and you'll be reporting it, and it's not hectic, and it doesn't give you a lot of anxiety because you're not directly dealing with the patients, but the reports you're going to give will change the life of the patients, and that will help in the further management. That is definitely their responsibility is there, but I would say it is pretty relaxed. And if you're in a corporate, you will have night duties maybe once a week, but once you become a senior, you won't have night duties also. If you are working in a scanning center, no night duties. So it's a fixed time and you can follow your passion. You can hit the gym, you can spend time with your family after that, etc. So I think radiology would be a great option. And in fact, it has great money. When you say the amount of effort you put for the money you get, I think radiology is very good. Another one would be nuclear medicine. Why I like nuclear medicine is because it's not very saturated. It is something very upcoming, and they are very high in demand because all corporate hospitals are having a nuclear medicine department. So they need a nuclear medicine specialist who will report their scans. So what are scans? What all types of scans are we talking about? I'm talking about PET scans, SPECT scans, ventilation perfusion scans, and myocardial imaging. So these are very much in demand, and I think nuclear medicine is a great choice because it's again like radiology, it's a 9 to 4 or a 9 to 5, and you get a lot more time after that. Radiation oncology, also known as radiotherapy. So here you directly deal with you directly deal with cancer patients because once they're done with your operation, chemotherapy, and you will be there to give the radiation. So you will plan on the protocols, you will decide how much radiation to give, what types of radiation to give, and so because of that, I would say this again doesn't have any night duties or any emergencies. It's again a 9 to 5 or a 9 to 6, and you have a pretty relaxed lifestyle because there are no emergencies in this. Dermatology is a great option. Why? Because there's one branch where medicine meets lifestyle. So here you have OPDs and you have all these minimalistic procedures, these aesthetic and cosmetic procedures that will give great outcome to the patients. So here you have fixed hours and you have no night duties. Psychiatry is another branch which I think is really upcoming in this coming world because there are a lot of people who are undergoing depression, but they are all subclinical or they are underdiagnosed. So I think now people are speaking up, and the awareness is spreading. So I think people will take more counseling. They need more treatment for their mental illnesses, including depression, etc. So I think there's an upcoming branch, and this will give you an again control over your life because again you don't have much 2 a.m., 3 a.m. calls in the night, and you have your consultations, and you can actually genuinely help a lot of people with their mental well-being. Another upcoming branch would be transfusion medicine. Why? Because there are very few doctors in that, and they have recently started MD program and DNB program in that. So here it's again a 9 to 5 job, and after this I would say you don't have night duties, and basically the work here is very good. Why? And it is very innovative also because you closely deal with the blood bank. You have plasma pheresis, platelet pheresis, bone marrow transplantation, and even hematology. So you deal with this, and I believe this is a very upcoming branch and it is something new. So the saturation is less and it has a great work-life balance. So another two branches that give a good work-life balance would be family medicine and community medicine. Again, you have a fixed working hours, that is 9 to 5, and after that you're done and you don't have much responsibilities after that. Now let's talk about anesthesia. So anesthesia is a branch that can be hectic and it can be relaxed also. It's about how you specialize or how you subspecialize after anesthesia. So if you want to be a general, if you want to be in general anesthesia, so you're going to work in hospitals. So you have any few pre-planned cases, let's say 3 cases, and your duty timings is 9 to 4. So once you're done with that, you have another team that will come and relieve you. And you have fixed number of night duties, let's say 2 duties. So you have a predictable time that, okay, this week I have 2 night duties and daily it's 9 to 4. After that, you're the night duty person of that day will come and relieve you. So but then during the work it'll be very hectic, because all these cases you have to take care of the vitals, you have to take care of the body of the patient once they are in anesthesia. So I think it's a beautiful branch, and after that it is pretty relaxed, because once they're done with that, they can come out and they can, go home, and it's a peaceful life after that. So that is if you're general anesthesia. Then you have pain and palliative. So that is a very upcoming branch in anesthesia, where you will be doing these minimally invasive procedures that will help relieve the pain that is not being controlled by tablets. So pain and palliative is again great. And but then there are very hectic branches like neuro anesthesia, cardiac anesthesia, and ICU management, that is critical care anesthesia. So these are very hectic, but I'm talking about the other part of anesthesia that is pretty relaxed. Another one would be emergency medicine. Now, emergency medicine, you might think that, okay, it is very hectic. I completely agree. Emergency medicine is very hectic. Why? Because you are in the frontier of the all the action in the hospital. Because you will be in the casualty and you'll be taking control of the casualty. Every person who comes to the hospital in emergency, whether it's the daytime or night, you will be dealing with them first. You'll be treating them, you will be stabilizing them, and if they need a specialty or a super specialty care, you will be referring them to there. But you're the first person, you're the first point of care. So it is very hectic, but again, their duties are in shifts. Let's say they have around 3 to 4 shifts in a day. So let's say your shift is 9 to 4. So you have to come half an hour early, because you have to take all the information you have pick up from the prior people. They will give you the rounds and they'll give you all the information. And once you're done with your duty, the last half an hour, again, you have to hand over all the duties and information of all the patients to the next duty doctors. So, but once you're done with your shift, you can go home, and you don't have much of a headache or tension of what's happening in the casualty, because you have another shift of doctors, emergency doctors, who will be taking the cover for you in the casualty. And there's a very upcoming branch, because now all corporate hospitals and even government hospitals, they want an emergency department. They have separately established an emergency department. So another disclaimer I wanted to tell you is that all these branches could be hectic during a residency. I am talking about post-residency life that is relaxed. So during residency, all these could be hectic, but more than hectic, the problem is toxicity. So the toxicity is many a times it is due to the HOD, or it is because of the associate professors, or even your seniors in MD or DNB or second year, third year, how they handle. It really depends on that. But that is something we really cannot control, because you can have frustrated people everywhere, whether they are your seniors or they are professors, and they are the ones who create this environment of toxicity. So I think I'm definitely not talking about that. So before you take these branches in any hospital, go talk to the resident over there and try to get a reality of what's actually happening there. So those were my picks for the coolest branches after MBBS, the ones that actually give you life outside your hospital. So tell me in the comments, what do you actually like, high earning jobs, or, more lifestyle. So what do you actually prefer? Do tell me in the comments, and I will try to answer your questions in them. And don't forget to like, share, and subscribe, because I'm planning to put more videos for MBBS students and NEET PG aspirants. Thank you.